On this episode of Bondi Vet,
Great job.
can Arvid help an injured police dog return to active duty?
Turbo lives to work every day because he does not want to be left at home.
Seriously, this is not good.
An equipment malfunction threatens to derail surgery on a fox's broken leg.
If this surgery doesn't go the way you want it to go, we'd have to put it to sleep.
He's just started to get a little,
And Chris struggles to accept his little girl is all grown up.
I feared this day would come, but I didn't think it would happen this early.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
At the City of Kennesaw Police Station in Atlanta, Officer Josh Hale is taking some time out with his four-legged partner, 9-year-old Turbo.
Hey. Turbo is a very special dog to me. He is very important to me in my life. We have been through a lot of things together. He has protected me, kept me safe, and he has saved a lot of officers in dangerous situations. Turbo was born in Czechoslovakia or Slovakia. He was trained in 5 different languages. He understands Czech, German, French, Dutch, and English for all of his commands. Bad guy, stop fighting my dog. Stand still. Post.
But for the past few months, this star recruit has been restricted to light duties after he suffered a serious knee injury on the job.
Turbo and I were called to assist Cobb County Police Department in locating 2 suspects who had attempted to commit home invasion and burglaries. During our track of the suspects, I heard him yelp. He never really showed that he was lame that day. The next day I noticed he was limping. I took him to the vet and they checked his knee, and they stated that he had a luxating patella, which basically was like a dislocated knee, and it would require surgery. Sorry buddy, you can't come out on the road today. You gotta stay in the office. Turbo lives to work every day. If I put my uniform on or my boots or my belt, he immediately starts barking and going crazy, ready to go to work because he does not want to be left at home.
But today, Turbo's long wait could be over. He's off to see Dr. Arvid to find out whether he's ready to return to active duty.
Hey Josh, how are you doing?
Good, how are you?
Good, hey Turbo.
Turbo has been visiting the practice every week for regular physio and hydrotherapy sessions.
Officer Hale, good to see you, good to see you.
See you too.
Turbo, how you doing, man?
He's doing good.
Yeah? You ready to get back to work? Yeah? You ready to get back to work? Oh man, he looks like he's doing good. And he's putting full weight on the limb. And
Putting full weight, yeah, not limping at all. Doing really, really well with it.
Good. Hey, I'm gonna have Dr. Underwood come in. He's gonna do a quick surgical assessment. Just make sure everything's good, do some range of motion. And then we're gonna get him back to rehab in a minute. And hopefully, like I said, this will be the last one, and then we can release him to full active duty.
Awesome. We can't wait. I know he's ready to go back
Looks
to work.
good, looks good. Is that all right with you, man? It is? That's good with you? All right, all right.
So he's doing good on his medications?
Doing great on his medication.
Arvid's colleague, Dr. Kirk Underwood, performed the original surgery on Turbo's knee.
One more, buddy. Most dogs have this procedure done. Sometimes it takes 6-8 weeks. He's lucky. He rebounded and had a good recovery.
With the surgical site now fully healed, Dr. Arvid needs to put Turbo's movement to the test.
The most important part of this whole process is the rehabilitation. The rehab portion of his treatment and therapy is very critical to getting him back to as close to 100% as possible so that he can continue to perform his duties at a high level.
All right, Turbo, we want to get you going.
To return to the job he loves, this devoted canine cop must now prove he's 100% fit.
The therapeutic exercises includes almost like an obstacle course where they have steps and balls that helps to increase strength, flexibility, balance, coordination. You can see how he's taking his time and taking the necessary steps up on the blocks. He's walking, bearing full weight.
That's perfect. Good job, man. Good job, Turbo. Good job. Good job.
So right now we are lasering Turbo's knee, which should help with the pain and allow for him to heal.
Looks like he's really enjoying that. I might have to try it out on my knee next.
So we're loading Turbo into the underwater treadmill for his last rehab activity of today, and hopefully everything goes well.
You get next. You're gonna run here in a second.
So as you can see, the cool thing about the underwater treadmill is one that is very relaxing. So the water is warm, you have the buoyancy, the water resistant, and it's in a controlled environment, which makes Turbo focus on the task he needs to do. So now we're about to increase the treadmill to a run, which is really gonna allow us to see how well he's doing with his endurance, how strong those muscles are, and the confidence that he has in that knee. Looks like he's putting equal weight on both limbs, which is a very good thing. Turbo has come a long way. You can see that he's bearing equal weight on both limbs. He's really trusting his leg. He's not even really thinking about it, which is exactly the end point we wanted to get to. So he's in cool down mode now, which is basically him just slowing down, letting his heart rate settle down a little bit, and letting him catch his breath. Good job. You're done. Good job. I can say it's time for him to go back to protecting and serving, man.
All right, you ready to go back to work? Yeah, you ready to get back to work? Yeah, buddy. Yeah.
Watching Turbo do his thing with his rehabilitation today made me ecstatic. Great job, Turbo. You're all done, man. Great job.
Dr. Arvid has cleared Turbo for duty, and I'm ready to see if he can run like he used to. You ready?
I mean, just kudos to the whole team. You know, it takes a village. It really does take a village.
You ready?
And I think we did a phenomenal job with helping Turbo get back to having a great quality of life and living the life that he loves.
No, sir. Oh. He's ready for duty, and he's running perfect.
Scott can never be sure what each day will bring. Now he's on the road after being called out to an emergency.
So I've just had a call from a girl called Lucy, who's actually a veterinary nurse at Wildlife Aid. That's a band of dedicated animal carers who look after sick and injured wildlife. She's called me about an injured fox. Now, foxes in the UK, they're a little bit like Marmite. You kind of either love them or you hate them. But as a vet, that doesn't matter to me. It's not my agenda. It's all about helping injured animals. So of course I'm going to go and see it.
The Wildlife Aid Centre is 21 miles from London in Leatherhead, Surrey. Staffed mainly by volunteers, the team handles more than 20,000 wildlife emergencies every year.
Got all the equipment for you here. There's a towel.
Okay.
Some Kevlar
Vet
gloves.
nurse Lucy was on duty when the fox was rushed in.
Now, I caught her yesterday, so I'm going to get you to do it today.
Okay, she's around this way?
That's right, just round there.
All right, I'm going in. Wish me luck.
Good luck. She was brought in after being found limping around a garden. We expected that she'd been hit by a car. We could see it was a horrible fracture, so we needed to knock her out, give her an anaesthetic, and then X-ray and have a look at the leg. I'm really concerned with what I've seen on that X-ray. I don't think the dressing is going to be enough. So we'll see what Scott says.
So whenever you're dealing with wild animals, at some point you have to catch them. So we're going to grab her with a towel, hopefully not get bitten, and then take her out for a quick exam.
Good girl. Well done. Good girl.
Well, actually, I was pleasantly surprised. Sweetheart, you are. Come on then. I was able to catch her nice and quickly, and she was actually a really sweet girl, so I've decided to call her Sweetie. All right, Lisa, I've got that muzzle in my pocket, actually. Can you grab it?
Got it.
There you go. Thanks very much.
We actually put muzzles on foxes the wrong way up because it covers their eyes and it means that she doesn't panic so much.
Yeah, well, being a nocturnal animal, they probably enjoy being in the dark, do they?
And she's much more relaxed and easier to handle when they're like that. So the biggest concern that we've got regarding her leg is if her leg can't be fixed, it means she can't go back to the wild.
Certainly feeling a bit of pressure now, because if this surgery doesn't go the way you want it to go, we'd have to put her to sleep.
Would you have a look at her X-rays and see if anything can be done for her?
All right, so should we try and pop her in the box then? Good girl.
That's it. So these are the X-rays that we took of the fox.
Yeah, it doesn't take much to see the problem, does it? Right there, so mid-radius ulnar or forelimb fracture there on this poor little lady. Oof, looks very, very swollen. Were the bones actually popping out of the skin? Was it an open fracture?
No, it's a closed fracture. There's no wounds at all, just the swelling, as you can see.
Yeah, no worries. Look, I will take the drive to Michael's and I'll call you as soon as I know anything. Okay.
Thank you.
All right, see ya.
Good luck, little one.
So for this, I think there's only one person in mind, one of my best mates, Michael Hamilton. He's a specialist orthopedic surgeon, and he's the man. When it comes to fractures like this and important patients, then yep, he's the one to call.
Scott has arrived at the Cherry Tree Veterinary Practice in High Wycombe, Buckinghamshire. Waiting inside for the injured fox is renowned orthopaedic surgeon Michael Hamilton.
Hello, mate. How you doing?
Scott and Michael became best mates 15 years ago, when they were single lads working together as locums in London.
Scotty's always been a hit with the ladies. He's a good-looking lad. He seems to be getting more handsome as he gets older as well, which is really, really annoying.
This is Sweetie.
Hello, you.
Seen the X-rays and things aren't looking very good. A fairly nasty fracture, so yeah.
Yeah, no, we can sort that. Yeah, we'll stick a plate on. Should be right as rain.
All right, should we go on through?
Good stuff, yeah, let's crack on. Follow me.
Michael is a Geordie. He says it like it is. He says it with a bit of colour, but he's a great surgeon.
So, Scotty, top of the box off or open the door?
Well, I think more to the point is that I got her in there, so I think it's fair that you get her out. Oh.
Interrupting?
Hello, Ems, come on in. It's BYO Vet Nurse Day today.
Oh, hello.
We're just trying to work out who's going to get the fox out of the box. He's got the expensive fingers, so I think it's going to be me again.
Hello, you're a bit gorgeous.
Emma's afternoon off has been cancelled. With Michael having no prior warning about Sweetie's surgery, the lads needed someone to help with the fox's anaesthetic.
So when I got the call from Scott about operating on this wild fox, I was really, really excited. Anything new that I've not seen before or not dealt with excites me, and orthopedics as well. It was just brilliant.
Okay, yep, okay. Thank you very much. Right, got her.
Yep.
First muzzle of a fox.
First muzzle of a fox.
Wildlife need to come out absolutely perfectly, because if we can't fix them, we have to put them to sleep. It's not a great proposition.
You happy?
Oh, it's static, yeah.
Nice.
Yeah.
Michael will be fitting a compression plate inside the fox's leg to stabilise the fracture.
There we go.
It's a routine operation that he's performed countless times. But just as the surgery begins,
You're kidding me.
there is a major hiccup.
Seriously, man, this is not good. Repair loan drill. Thing.
Michael's personal drills were taken for servicing yesterday, and the replacement drill has failed.
Today of all days. If you swear enough, it'll work. Piece of... Right, plan B. Everybody think happy thoughts. Oh, you've got to be You're kidding me. Like, what the f?
No, I think that's understandable.
Oh, hello.
I honestly can't explain what went wrong with the drill, but it certainly seemed to respond to Michael's colourful language.
I'm not going to burn that up because we might just need to use that to put the screws in.
He was definitely sweating a little bit, was Michael. I think having to go back to using a hand drill was quite tough for him.
Michael Hamilton gone old school.
This is not even school. This is...
This is prehistoric.
It's fine, it's fine.
Yeah,
Wait a minute, if you can hold that one. Come on, drill. Come on, darling. Come on, darling. Once we've got... It's going all right now. This fox is going to use this leg, hopefully, pretty much straight away.
With the crisis over in the operating theatre, Emma lightens the mood.
How many times have you two operated together?
Probably like at least a handful of times.
Yeah, probably not more than 10.
Must say I'm quite impressed with your equipment.
Thanks, mate.
Me too.
Thanks, Emma.
Thanks, Emma.
I like your equipment, but Michael's is just a little
Shinier.
shinier. Well done, boys. Well done.
We're not quite allowed to celebrate just yet until
Okay,
we've got
fine.
the X-rays. You're gonna do that.
Michael's a magician. He does such great work. Okay, X-ray. And it's a beautiful thing to see. And the plate is on really well. I reckon Sweetie's got a great future ahead of her. Yeah, it's great. Nice one. Well done, mate.
It's all right, mate. Yummy one.
Good job. Yeah.
Cool.
Waking up now. It was a long surgery, wasn't it? Good girl. What a sweetheart you are.
Hopefully we'll be seeing her running off into the wild in 5-6 weeks. She should do well. She's young, which is definitely in her favour.
Emma from Wildlife Aid will now take Sweetie back to Surrey for rehabilitation.
There you go, Emma. One fixed fox, all yours.
Thank you very much.
My pleasure. Take care. Bye, sweetie.
I'm very happy with the operation. She's a very lucky fox, so I'm glad for her.
At Wildlife Aid, there's good news about Sweetie.
The hand, that's perfect.
Michael's surgery has been a success, and the fox should be back in the wild in just a few weeks.
Nothing beats working with wild animals. So many times you let them go and you see them walking off and they look back as if to say thank you, and that's the best feeling in the world, it really is.
I wouldn't do that, Cricket.
In Bondi, 5-month-old Cricket has well and truly settled in to her new life with Chris.
There's definitely something going on. Cricket is obviously the kitten that I adopted a few months ago after she was found in a park, in a box.
Good Samaritans brought the little orphan into the clinic.
See, she's not very happy putting that left front leg down.
And X-rays revealed the tiny battler had a badly broken leg and needed urgent surgery.
All right, I'm done there.
She's had quite an interesting few months with me. She's understood the meaning of destroying furniture, keeping me up late at night, waking me up early in the morning. But now there is a new twist in the story of Cricket. I feared this day would come, but I didn't think it would happen this early. She's only just turned 5 months old, and this purring, and this calling, and this bum in the air thing can only mean one thing's going on.
Cricket is on heat. And Chris isn't the only male to notice Cricket's change in behaviour.
Exactly how many guys have you invited around? This is kind of every dad's worst nightmare. Their little girl has grown up and there are hundreds of men hoping to get their little mitts on her. Oh, you're looking outside, are you? Yeah, you know why? Because you attracted him. She's in season and she's not scared to let people know about it. I'm obviously a big believer in desexing cats. The last thing we need are more unwanted kittens. I'm just surprised she's come on heat this quickly. there's only one thing to do. She's coming to work with me tomorrow, and we're going to sort this whole thing out. This girl has grown up just a little bit too quickly. Tomorrow you're coming with me, and he's going to be disappointed. Cool. Don't get in the way of a young girl and her plans. Remember this place?
Next day, Cricket has the first appointment booked in at the Bondi Clinic.
Oh, hello. It's Cricket. Today is the very necessary next step in the saga of Cricket. Clearly, when she's on heat, we need to do something about it, because when bad girls stay bad, eventually their past catches up with them. She's just started to get a little, yeah, I know. A little bit, I've kind of lured her in here on the belief that since it's a couple of months since the operation, it's time to check how her legs are healed. Okay. And if that pin is nice and stable. Cricket had a bad fracture that required a pin to essentially hold the bones in place. That pin's now been in there for a couple of months. So there is an opportunity today to potentially remove that pin if the pin has loosened or if the pin is just no longer necessary.
They're the same length, are they?
Yeah,
pretty much.
She's got a full range of movement there.
Yeah.
So I just think probably the best thing for her is to take an X-ray. Cricket certainly had a good recovery and a good rehabilitation, but she's still been a kitten and she's still been jumping all over the place and all over me. So there is some concern about how quickly and how properly her bones have healed.
The X-ray will show the metal pin in Cricket's leg and whether it has stayed in the correct position.
Yep, go. Pin actually looks all right. It kind of looks like a normal humerus with a pin inside it now. Yeah. The X-ray is showing two really interesting things. First of all, the bone itself has healed up brilliantly. You would not even know there was once a serious fracture there. But secondly, the pin is not an issue. It's sitting well inside the bone. In fact, the bone's grown up and over the top of it. So it doesn't need to be removed today. Look how cranky you are. What is it? It's almost like she knows what's coming next.
Well, they do have that extra sense, don't they?
While the X-ray shows she doesn't need one operation, there is no dodging the desexing today. That is going to happen, and I'm going to make sure of it.
Oh, you're a daddy's little girl, really, aren't you? Hey?
Daddy's trying to be strong, so
let's get on with it.
Hold the sympathy for half an hour.
Going over and out. Lick your lips, yep. That's pretty good.
I guess the challenge here is not overcomplicating this surgery. It is very much a routine operation. It's a spay. It's an operation I've done thousands of times before, but somehow today it's different. And it's different because it's Cricket. She's my pet. So I found a uterus here, and certainly it's looking a little bit more inflamed, I guess, than it normally would be. They're the ovaries of a little kitten that's been on heat. You can see that they've got extra fluid in them and they're really looking like they're busy. It's all grown up. What's that?
That can't be the ovary there, surely.
No, it's not, because the ovary's further up here.
It's a bit strange.
Looks like she's developed a fluid-filled lump just in the wall of her uterus. You know, there is a chance that she's actually been able to feel this. It's not something she's been, I guess, able to communicate to me, and certainly she hasn't looked like she's been in pain at any stage, but to have a big cyst in the wall of the uterus, it's abnormal. In an animal so young, it's highly abnormal. But the fortunate thing is that today I can actually remove it. We may, through preventing an unwanted pregnancy, have actually prevented another disease from occurring, so that's a nice thing. Okay. So there's the other half of the uterus there. Yep. So I'm happy with how that's looking. I'll just release it to make sure that bleeding's stopped, which it has. All right, we can start closing up.
Okay.
Thankfully, what should have been a routine operation was just that. Everything's run smoothly. We obviously discovered the cyst in there, which was quite remarkable, but that's been removed. You waking up? Okay, come on. You ready to look at me? Not yet. Give me a stand. So now, it's full steam ahead to what should be a normal life. Well, normal, apart from the fact she lives with me. Good luck with that.
You sleep it off.
A lot of people complain about cats needing exercise, but for you, it's never really a problem, is it?
In Bondi, it's been 2 weeks since little Cricket was de-sexed.
Always that little bit too far away, right?
But Chris's cheeky housemate isn't taking any time to rest and recuperate.
Normally an operation like desexing will slow a cat down for quite a few days, maybe even a week or so. For Cricket, not so much. In fact, if anything, over the last few weeks, she's kind of stepped it up a notch. Now you're growing up, we should really think about school. But what if the teacher gets out a laser pointer? Is this going to happen? Instead of chasing male cats, she now chases lasers and balls all day in, day out. I always knew that Cricket was a bit different. It's kind of the reason why I adopted her in the first place. I never really realised just how different she'd be. A lot of people think cats are independent. Cricket is not one of those cats. She's needy. That's what I mean. Just always has to be there. Centre of attention. We're going to have an interesting life together.
Hey Liz, come and check this out.
Oh wow, you don't see that every day.
Not at all.
A very peculiar looking creature has been handed into the Australian Reptile Park receptionist, Penny.
We should probably get Tim. I'll get Tim. Have a look, yeah. Penny to Tim.
Go ahead, Pen.
Hey Tim, we have something here for you that you'd probably like to see.
Sounds interesting. What is it?
It's a bit of an odd one. You'll probably have to check it out for yourself. You're gonna freak.
Righto, I'll be down in a minute.
This is something I've never seen before. Tim's definitely going to be excited to see this one.
What have we got?
Hey, I think we've got a blue-tongue lizard.
Holy moly. You do have a blue tongue, but it's got 2 heads. Look at that. Fair to say, in a long time in zoos, we've never seen that, hey?
Never.
This lizard is a real anomaly. I mean, it must be a chance of 1 in a million in the wild that something like this is born, and for it to have been found alive, well, spectacular.
Do you think he's going to grow?
If he's got 2 independent brains and he can swallow and his body's all right, then he might live. It's great that someone found him and recognised that he was different and has brought him to us. Things like this in the wild, well, if they're disadvantaged even a little bit, the wild is harsh, and I don't think he would have survived out there.
What are you going to do?
Down to the vet, hey? We need an answer to know that he's not in pain or anything like that, and then we'll look after him. Looking at him, physically, he's okay. But I'm not a vet, and I guess I really need to know what's going on the inside. I'll take him down now. I'll let you know how I go when I get back.
Thanks, Tim.
Pete the vet, he's in for a surprise. I've taken him weird and wonderful things over the years, but never anything with 2 heads. Good afternoon, guys.
Hello, Tim.
I know I don't have an appointment, but do you have time for a special little friend of mine?
Tim has arrived at the Green Cross Vet Clinic, about 5 minutes from the Australian Reptile Park.
Have you ever seen anything like that?
He's hoping Dr. Peter Nosworthy can provide some more clues about this very unusual 2-headed blue-tongue lizard.
I've never seen a lizard like this before, and I'm worried about how it's going to survive. I'm just going to have a look in his mouth for a moment.
One blue tongue?
Everything looks all right in there. All right, mate, let's have a look on the other side. Yeah, okay. Superficially, from what I can see, they both look normal.
Is it possible that both heads work and swallow and
I'm sure it is, yeah. I mean, I don't see why it couldn't be. I'd like to take an x-ray of its spine to see that it has got, you know, something that runs from the back of one of its heads down through until the tail. X-rays. I would then like to pass a tube down both mouths to see which one goes down to the stomach or whether they both do, out of interest, and see which one we should be feeding, or can we feed both? Okay.
What do you got? 1 or 2 brains?
I think we have only got 1 brain, Tim.
1 brain, 2 heads?
1 brain, yeah. It's not a bad thing. It's not a bad thing.
And the rest of the body looks healthy?
Normal.
Normal? Wow.
Normal from 2 heads backwards, he's normal.
The x-rays are done and Pete's happy. But what he wants to see now is what actually happens when he puts a tube down the throat. Do both mouths feed through to the stomach? Mouth open.
Mouth open.
Pete puts the tube down one side and it feeds back to the belly. He then goes to the other head and it does the same. Now that means both mouths are intact and working.
Okay.
So that's good.
He can swallow both sides. Both sides will run down into the abdomen.
It's a great result. But before Tim leaves, there's one more thing that needs to be addressed.
What are you going to call him?
How about Janus?
Janus?
Yeah, it was the Roman god of new beginnings. He had 2 faces.
Janus?
Janus, yeah.
Well, that's lovely. 1 lizard, 1 brain with 2 heads.
New
Janus.
start, Janus.
I love it. I'm going to take him home, try and get him feeding, get him strong, and hopefully he can live a normal life. Well, that's his home, at least for the next little while, until he gets established and starts eating and gets bigger and stronger. I don't know if he's ever eaten since he was born, so I'm actually going to try and just force a little bit into him, and maybe that'll give him a taste for it, and tomorrow or in the days to come, it'll stimulate him to start feeding by himself. My little mate. I'm just going to gently pry open his mouth, just put a bit in, just get a little bit of food in there. That's it, good boy. He's eating it. He's licking it. That's fantastic, he knows what to do. Good boy. Let's try head number 2. Same again. That's a good fella. When I was down at the vet's, Pete said he's got a good response in the mouth. He sure does. He's swallowing that food from both heads. The last thing I'm going to do is actually try a little cricket. Okay, that's it, mouth's open. Cricket's in. Look at that. He's eating. Beautiful. In the wild, he wouldn't have survived. At least here, we can give him a chance. That'll be a good little home for you, mate. You got everything you need in there.